Thank you.
Well, Lisa and Jill, thank you so much for having me today, and thank you for covering this topic. And I know that that may sound a little bit strange, but part of it is, first of all, when you have a child with a disability, everybody tells you to sign up for a waiver, or sometimes they just say Medicaid. But the problem is nobody ever tells you what in the world it is or why it's important. And on top of that, there have been so many changes when it comes to waivers just in the last year and a half, trying to stay up to date and figure out what is really going on right now. What is the current information? What is the accurate information is really difficult. And as I say that, we've got new changes going into effect December 31st of this year. So this will be the third set of changes in a single calendar year, and there are more changes on the horizon. So that's why, I'm very, very glad that you've joined us so that you can learn about the basics of waivers and also learn about some of the changes that are going on, and so that you know the most up-to-date information. So thank you so much for having me. I really appreciate it. So let
Thanks for
me
joining us.
let me go ahead and share my screen. So there we go. Um, So let's start with what is a Medicaid waiver? Because, like I said, everybody tells you to sign up, but you guys know when you've got a child with a disability, you are given a list of like 983 things to do. That's on the to-do list, but since nobody ever tells you what it is, you don't know why it's important, so you may not move it up on your to-do list. Well, a Medicaid waiver is the common name that we use for Medicaid home and community-based services. And it provides a combination of both Medicaid health coverage and supports and services that are provided in the home or in the community, but that insurance doesn't normally cover. But here's the catch. When you have a waiver, it changes a lot of the Medicaid rules and especially a lot of the Medicaid financial rules. Because I know there are a lot of you out there thinking, oh, well, if it's Medicaid, we make too much money for that. So that's not going to help us. That's just it. When you've got a waiver, it changes those rules. And the biggest rule it changes is that when you have the waiver, they do not look at family income or family assets. They only look at your child's income and your child's assets. So that is how most children are actually able to have a waiver, is because of that rule that ignores family income and assets. But here's the other thing is that when you have a waiver, the income guidelines for Medicaid are greatly increased because typically for a person to have Medicaid, they can't be above the poverty line, or at least much above the poverty line. Not when you've got a waiver. There are actually work incentives built into this. And I know it sounds weird that I'm talking about work incentives, and I'm mostly talking to families with children under 18. But the reason I say this is so that you know your child will not be forced to live in poverty just so they can have the help that they need. So we do have a few of the numbers for 2026. And in 2026, a person on a waiver can actually make $2,982 a year for a month from all sources. That's about $35,000 a year, and still have full Medicaid. And if they're actually able to work and earn more than that, there's a special category of Medicaid called MedWorks. It literally stands for Medicaid for Employees with Disabilities, but it's a program that so that people with disabilities are able to work and still have the health coverage they need from Medicaid so that they're able to work. And with that, a single adult can make over $55,000 a year and have full Medicaid. So again, I want you to know that these programs are out there, but your child will not be forced to live in poverty just to be able to access that. Now, there are also asset limits when you have a waiver, or for most types of Medicaid that you would need for that waiver. The state uses the term resources, I'm sorry. When I hear resources, I think of the libraries and the parks departments. I don't think of money. That's why I tend to use the word assets. But typically speaking, you cannot have more than $2,000 in assets in your loved one's name. But there are a whole lot of exceptions to that. First of all, they can own a house that they live in that is not counted against them. They can own a car that is not counted against them. They can have any amount of money in a special needs trust. None of that will be counted against them. And they can have up to $100,000 in an ABLE account that will not be counted against them. And there are tons of other exceptions beyond that, but that just gives you a brief idea. And if you've got more questions about that, you can always call us at the ARC and we can talk you through that. Now let's talk about the types of waivers because this is some of the information that has been changing in the last year and a half. First of all, the first type of waiver are the skilled nursing waivers. That's just the category. That's not their official name. It's the category of waivers. These are for people who have more medical or more physical disabilities. They are designed to help people stay in their homes and not go into a nursing home. And so, in order to qualify for this waiver, you have to meet nursing facility level of care. And the waivers that are available through this are the health and wellness waiver. It used to be called the aged and disabled waiver, but now it's the health and wellness waiver, and that is for people 59 and younger. There's the pathways for aging waiver. Again, that used to be part of the aged and disabled waiver, but they broke that waiver up. Pathways for aging is only for people 60 and older. And then there's also the traumatic brain injury or TBI waiver. Now, all three of those waivers do have waiting lists at the moment. To apply for this waiver, that part has also changed. You used to contact your local area agency on aging. Now, to apply for one of those waivers, you want to call a company named called Maximus, and you call them at 833-597-2777. And you tell them that you'd like to apply for the health and wellness waiver and you need to set up a level of care assessment. Again, all of those programs do have waiting lists, but there are a few ways that you can move up on the waiting list. The three ways you can do that are if you are currently admitted inpatient at the hospital. Now, not just, you're in the ER, not just that you're having outpatient surgery that day. You have to actually be admitted to the hospital. And if you contact Maximus while you are in the hospital and say you need to have that waiver before you leave or so that you can safely leave, they can actually give you priority status for that waiver. People transitioning from 100% state line item funding. Okay, so that's how the state will say it. What does that mean in real life? Well, typically, they're talking about people who use a program called Choice, which is a program that can help provide some services, typically to older adults or to people with disabilities in their home, but they may not qualify for a waiver yet. If you are on that and you want to transition onto this waiver and you meet the level of care to do that, you can bump up on that waiting list. And then the last priority status, for lack of a better phrase, are people transitioning out of institutional settings. So if you've got somebody who's in a nursing facility, or you've got somebody who may be at especially kids, which is a children's nursing facility, or maybe they're at Daymar or TC Harris or something along those lines, and they have more of those physical health needs, that may be a way, that can be a way that they can also transition out of those facilities so that they can go back home and stay in their homes. Then we have the developmental disability waivers. Again, that's not their actual name, that's their category. These are for people who have an intellectual or a developmental disability that occurred before age 22. And if you're not sure what they mean by intellectual disability, because because we don't do a good job of defining terms very well. An intellectual disability is an IQ of around 70 or below. And I say around 70 or below because there is still, that little bit of leeway, that little bit of a standard deviation. So if you have an IQ of around 70 or below, that's officially an intellectual disability. And if you have an intellectual disability or a developmental disability, like autism or like cerebral palsy or something along those lines, um, or if you have a condition that is similar to any of those, that can possibly qualify you for a developmental disability waiver. These are just, but these have a very different focus. The skilled nursing waivers are designed to help you get, or help you to, or help, blah. The skilled nursing waivers are designed to help keep you in your home and not go into a nursing home. The developmental disability waivers are designed to help people with intellectual and developmental disabilities get out and be as active in the community as possible. Now, to qualify for this level or for this waiver, you have to meet Intermediate Care Facility for the Developmentally Disabled, or ICFDD level of care. And here we've got two waivers. We've got the Family Supports Waiver, which is what most people get. And then we have the Community Integration and Habilitation, or CIH waiver, which is emergency based. By the way, everybody just calls it a CIH waiver because that name is too long. So don't worry about that. So how do you apply for these waivers? Well, this is a little bit easier. You can go, the state has actually put the waiver application online. And so you can go to bddsgateway.fssa.in.gov, or you can use that QR code right there and it will take you to the application. This is also the same application you would use, an eligibility process you would use if somebody is seeking a group home placement. And a group home is a very different thing. Um, the good news about the waiver application, it is really, really simple. It will take you all of 5 minutes to fill out. The two hardest things are number one, tracking down your kid's social security number. And then second, remembering every time it says you, it really means your loved one. So yes, they are asking for a 4-year-old's marital status. Okay, know that. The other hardest thing is that you have to type your address like 4 separate times, because heaven forbid we have a checkbox that just says same address as above. But that's really it. There are three priority categories for this waiver too, because the family support waiver does have a waiting list as well. The three priority categories for that are 18 to 24-year-olds who have finished school, because the state recognized how hard it is to go from being in school and having all sorts of supports to suddenly having nothing, and they don't want that to happen. Second priority category is children, and that doesn't have to mean children under 18. It can be adult children too, of active duty service members or veterans. I have helped some individuals in their 40s where, mom or dad was in Vietnam. Guess what? That counts as veteran status. And so we can get them moved up on the waiting list that way. Or individuals who no longer meet the level of care for the health and wellness waiver, but also qualify for the family supports waiver. Because sometimes we have individuals, especially children and young adults, where they have multiple disabilities. And so they may have an intellectual or a developmental disability, but they also have really high medical needs. And so they may start off on the health and wellness waiver. And if their medical condition improves and they no longer meet the level of care for health and wellness, but they still have that developmental disability, they are supposed to be able to move over to the family support waiver right away. Um, that being said, I will tell you that last week, like literally last Wednesday, the day before Thanksgiving, the state did announce that the family support waiver and the CIH waiver are actually full. So they are not going to be giving out any more family support waivers or CIH waivers until at least July of 2026. We'll get a little bit more into that here in a couple of minutes. Now, what to expect? If you're applying for a skilled nursing waiver, Maximus will come and they will do an in-person assessment to help and really That's just going to be an interview where they will ask all sorts of questions about what your needs are, what your abilities are, to help figure out if this waiver is appropriate for you. Now, the assessment tool that they use to qualify for one of those skilled nursing waivers, that tool changed July 1st of this year. They are using the Inter-RAI suite of tools, and they're trying to make it so that it is more age and developmentally appropriate. Because sometimes we had, especially very young children, where things that were developmentally appropriate based on their age was still helping to qualify them. So for example, if you have a 2-year-old who cannot bathe themselves, well, no 2-year-old can bathe themselves. That alone should not be something that helps you qualify for a health and wellness waiver. If you have a 16-year-old who cannot bathe themselves, well, that's something that's very different. And so that should be something that should be considered in that eligibility determination. But so you'll have that interview, and then they're also going to review your medical information and your medical records to see if you should qualify for this waiver. If you're applying for the Family Supports or the CIH waiver, the Bureau of Disability Services, by the way, it used to be called the Bureau of Developmental Disability Services. They changed their name a couple of years ago in anticipation of taking over those skilled nursing waivers too. So now they are the Bureau of Disability Services. If you've wondered about why people are saying it different ways, that would be why, is because the name changed. But at the same time, people still call it the BEADS office. So if you've ever heard somebody talk about the BEADS office and you were furiously trying to Google it and couldn't find it, it's the Bureau of Disability Services. But they will conduct that initial evaluation and review for the family support and CIH waivers. First, they're going to have you bring something called a confirmation of diagnosis form to your loved one's doctor to have them fill that out. That's just to confirm, yep, they've got an intellectual or a developmental disability, and yes, they had it before they were 22 years old. Then they're going to do a level of care assessment. The level of care assessment tool that they use is going to change on December 31st of 2025. So in about 3 weeks, 4 weeks, they're going to change the tool that they use too. It's also going to be the Inter-RAI suite of tools, but a different set that is more designed for people with developmental disabilities. They're going to do that assessment tool, which again is about a 1-hour interview where they're asking all sorts of questions about what you can do and what you need help with. They're going to review those about, and then they're going to ask for what they call collateral information, which is reviewing any evaluations you've had done, reviewing a person's IEP, and any other documentation that may show the person's needs and their abilities. Now, like I was saying, there are waiting lists for almost all of these programs. The family support waiver, the health and wellness, the TBI, and the pathways for aging waivers all have waiting lists. The CIH waiver technically does not have a waiting list because it is emergency based. The good news is that the state does have a wait list portal, and I've got the website there, or you can always just Google Indiana waiver wait list, and it should come up. And the wait list, if you are on the waiting list, it will show you either an application or an approval date. The application date is for the family support waiver. The approval date is for those skilled nursing waivers. That is what your place on the waiting list is based on. Okay, so they're not going to tell you, oh, you've got, 16 more months. They're going to tell you what your application or your approval date is, and that's what's going to guide you on that. I would say right now for the family supports waiver, I think it's safe to say that it's probably about a 4-year wait at the moment. That is totally an estimate. I will be perfectly honest with you with that. On those skilled nursing waivers, we don't know what those waiting lists are like. And the reason I say that is because until April of last year, there hadn't been a waiting list for the health and wellness, or for, at the time, the aged and disabled waiver, or the TBI waiver for more than a decade. So the fact that they've got waiting lists now is brand new. And they are still trying to get their footing in figuring out about how long it should take for somebody to get through that waiting list. I will say I was looking at some information on the state's website this morning, and it looks like they are they that on that for the health and wellness and pathways for aging waiver, that they are pulling off people who originally applied in October of 2024. That's the most recent information I have, but that's something that's always going to be changing too. Um, but like I was saying earlier, the family support waiver and the CIH waiver are currently full because whenever a state provides those home and community-based or waiver services, they actually have to create an entire written plan that lists absolutely everything possible. So it explains what the waiver is, who it's going to serve, how they're going to deal with waiting lists, what types of services they are going to provide. I kid you not, each one of the plans for each one of the waivers is between 300 and 400 pages each. So they're very, very detailed. But one of the things those plans also contain is a maximum number of people that they are able to serve in any given year. The state has actually hit that for both the family support waiver and the CIH waiver. To my knowledge, this has never happened before. So this is something brand new. So there will be no new waiver slots until at least July of next year for the family support and the CIH waivers. But let's talk about that CIH waiver because it is emergency based. And so to qualify for that, a person has to meet the criteria or the qualifications for a developmental disability waiver in general. So they have to meet that level of care. They have to be on an appropriate category of Medicaid, because believe it or not, when I started this job, I thought Medicaid was just Medicaid. I was wrong. Here in Indiana, we have 37 different types of Medicaid, and then we have subcategories within some of those categories. So some of those categories of Medicaid work with a waiver, and some don't. One of the biggest examples of that is the Healthy Indiana Plan, or HIP. That is not a waiver compatible category of Medicaid. So you do have to be in a waiver compatible category of Medicaid, which typically means that if you are an adult, the Social Security Administration has to say that you are disabled. And you have to meet one of the following emergency categories: loss of caregivers with no other caregivers available, caregivers over the age of 80 with no other caregivers available. That means if dad is 80, but mom is 78, you've got 2 more years to wait before you would qualify for a CIH waiver. Extraordinary health and safety risk, and they really mean extraordinary. The fact that school is done and there is no one to stay home with your child is not an extraordinary health and safety risk to the state. That is just an ordinary safety risk. Aging out of a childhood placement. So if we've got a child who is in foster care, or we have a child who's been placed at, say, Daymar or TC Harris by the Department of Education or by the Department of Child Services, and they are ready to age out of that placement, that can be a reason to get that CIH waiver. Leaving an institutional setting like a nursing facility, like a state psychiatric hospital, like a group home, because I know most people tend to use the phrase group home and waiver home interchangeably. To the state of Indiana, a group home has a very specific meaning, and it is technically considered a small institution. And then substantiated cases of abuse, neglect, or exploitation. So one of the biggest things that differentiate the types of waivers are their budgets. So a family support waiver has a budget that is no larger than $26,482 per year in waiver services. Now, that's none of the medical stuff that goes through Medicaid health coverage. This is exclusively for waiver services. Whereas the CIH waiver, the health and wellness waiver, and the TBI waiver, their budgets are based on the individual's needs. Now, the Pathways for Aging waiver also bases their budget on needs, but both with Pathways, which is for people 60 and older, both the medical care and the waiver services are governed by a managed care entity. In this case, it's either going to be Anthem, Humana, or United Healthcare. So let's talk about, the services that are available because again, I've told you that's what these are for, but didn't go into much detail here. So again, with the skilled nursing waivers, those are designed to provide the medical supports needed to keep a person in their home. And so as a result, most of the services are actually provided in the individual's home. So that can be attendant care. That can be care coordination because a lot of these individuals have a lot of different specialists. Sometimes they're good at talking to each other. Sometimes they're not the best at talking to each other. So you can have that care coordination to make sure everybody's on the same page and everybody's getting all of the same information and sharing all of the same information. Caregiver coaching is another service available, and this actually became some that was a little controversial when it was first proposed back in 2024. There were some families who were really, I'll be honest, they were insulted at the idea of it because they're like, who knows better how to care for my child than I do? And I totally agree with that. At the same time, if your loved one were to develop a new condition or have a new health matter come about, wouldn't it be great if you had somebody that you can talk to about that and about how to integrate that? So let's say, you're going along and then suddenly your loved one develops diabetes. Wouldn't it be great to have somebody to talk to about, okay, now how do I add this into everything else we're doing? How is this going to impact their medications? What are the dietary changes I need to make? What are the things I need to look for? So think of caregiver coaching more as somebody to help you figure out, what to do, especially when things change. Adult day services are available under these skilled nursing waivers, but there are about 20 different services available through these waivers alone. Then we have the developmental disability waivers. So that's the family support and the CIH waiver. Like I said, these are designed to help people with intellectual and developmental disabilities get out and be as active as possible in the world. So most of these services are actually in the community. So some examples of that are day habilitation, which is one of the broadest services out there. And no, it doesn't exclusively have to be done in the daytime. It can also be done in the evenings and on weekends. Day programs, extended services, which are employment-based services. So let's say your loved one is working with VR. They get a job, they get stabilized in their job, and VR is ready to leave, but maybe they need somebody to kind of come in and check on them, every so often, just to make sure things are going well. That's where extended services can come into play. Career exploration and planning so that we can make sure our loved ones know what types of careers are actually out there and giving them the opportunity to try some of those before they commit to it. We have a lot of people who love the idea of working with animals until they realize that means they also have to clean up after them. Or, they may think, oh, I love to cook. Well, my son's an example of this. My son went to the Erskine Green Training Institute, and he was looking at several of the different jobs that they have. And one of the jobs he was interested in was the prep cook because he was learning to cook at home. He likes that. He loves watching Food Network. So he thought maybe he'd want to do that until he found out he'd have to wear a beard guard. Then he had no more interest in that. And so those are the types of things that exposing people to different careers, not just jobs, but careers, and then helping them try, find out what it's really like, really can make a huge difference. And there's a service now through the waiver to be able to do that. Transportation can potentially be a service available through the waiver, but there are about 30 different services available with those developmental disability waivers. And as I said, we've got more changes coming December 31st. Like I said, this is the fourth set of changes in a year and a half. That is not common. Normally, when the state writes a plan for a waiver, those plans are written for a 5-year period. There could be some minor changes here and there, but typically speaking, there's not going to be some major changes. The last year and a half, 2 years, we've seen a ton of changes. And so the impact of some of those changes that are coming are the services that are available, who can provide those services, and some are just administrative changes. And some of the changes are in direct response to the public comments people have given. And especially on who can be paid caregivers. That was probably the big issue in 2024 was when they were changing that aged and disabled waiver into the health and wellness and the pathways for aging waiver. One of the things they changed was who could be a paid caregiver. And legally responsible individuals, which exclusively means spouses of a person with a disability or the parent of a minor child under 18 with a disability, previously had been allowed to be a paid caregiver. And in 2024, that changed. They were only allowed to get those legally responsible individuals could only be paid for a service called structured family caregiving. Um, Effective December 31st of this year, legally responsible individuals can possibly be paid again under the TBI, Health and Wellness, and Pathways for Aging waiver if they meet the requirements under the extraordinary care definition. So this isn't going to be open to everybody, but it will be open to some. They are also going to add it to the family supports waiver for the first time for what are called PAC services or participant assistance and care services. In order for a legally responsible individual to be the paid caregiver, it must be in the interest of the individual, and they have to meet the definition of extraordinary care, which means caregiving needs beyond the typical age-appropriate caregiving. So again, if we've got a 2 or a 3-year-old who's not potty trained, that is, just developmentally typical for a 2 or a 3-year-old. If we have, say, a 16-year-old who is incontinent, that would be something that would be beyond the typical age-appropriate caregiving needs. But to meet that definition of extraordinary care, they also have to meet intensive nursing care needs. So things like they need a continuous ventilator, they need tracheostomy care, they need TPN care, or other comparable needs. Notice these are all physical health needs. The state has not included behavioral needs in this definition at this time. And I say it like that because what we have seen is when families, keep up that pressure, sometimes it can make a difference. And this is one of the ways that we were able to make a difference. So paying LRIs is going to be for attendant care and for participant assistance in care or PAC services. They can still get paid for structured family caregiving if they want to continue doing that. But when a legally responsible individual is getting paid for the care, they will be limited to only being paid for 40 hours per week for all LRIs combined. So if mom and dad are both getting paid as caregivers, it's not that they can be paid 40 hours each per week. It's a combined 40 hours for both of them if their child is under 18. If their child is over 18, that's different. Because one of the other things that's happening is that the state is aligning who can be paid as a caregiver on the skilled nursing side with what has already been in place on the developmental disability side. So for the developmental disability waivers, this is not a change at all, but for the skilled nursing waivers, this is. Legal guardians of adults and relatives will be limited to being paid for no more than 40 hours per week as a paid caregiver per waiver participant. So if you've got 2 loved ones on waivers, you can be paid to care for one of them for 40 hours a week and the other one for 40 hours a week. So it's per waiver participant, but they are aligning that definition of relative. And so again, this is not a change for the developmental disability side, but it is a change for the skilled nursing side. So that definition of relative is going to be a parent, it's going to be a sibling, a grandparent, a child or a grandchild, aunt or uncle, niece or nephew, first cousin, and doesn't matter whether they are natural, step, half, adopted, or in-law, that they are very much broadening that definition of relative, and a relative can only be paid for no more than 40 hours a week as a paid caregiver. So the eligibility determinations are also in the midst of changing. On July 1st of this year, the Traumatic Brain Injury, Health and Wellness, and Pathways for Aging waiver changed the eligibility tool that they use. They are using that RAI suite of tools, home care, pediatric home care, or early years. And again, you go through Maximus for that initial level of care determination. And then on December 31st, here in a couple weeks, the Family Support Waiver, CIH waiver, and Supported Group Living, which is the official name for group homes, their eligibility tool will change. They are also going to be using the Inter-RAI suite of tools. Early years, um, CIHY, MHDD, what that means is Children and Youth Mental Health and Developmental Disabilities tool, and the Intellectual Disability tool. But the Bureau of Disability Services, or BEADS, will make that initial determination, and then case managers will conduct annual redeterminations going forward. There are going to be some new services that are available. First of all, benefits counseling will now be available for the Family Support Waiver, CIH waiver, TBI waiver, and Health and Wellness waiver. That is especially helpful when it comes to Social Security and making sure people know what benefits may be available to them and how working will impact their benefits and how they can maximize their ability to work. Extended services, which is that employment service, will be available on the health and wellness waiver for the very first time. So I know this makes me a geek. I am really, really excited by that. And then self-directed care is coming to the family support and CIH waivers for the very first time. Self-direct. So right now, when you use a service on the family support or CIH waiver, you have to go through an agency for that service. And then you find what they call a direct support professional or DSP who works directly with your loved one. With self-directed care, instead of going through an agency, you as the waiver participant, or as the legal guardian or the parent of a child who's on this waiver, you are the one who is in charge of recruiting, hiring, training, and maintaining your own staff. So it's kind of taking the agency out of the whole process. You have to fulfill training and background check requirements in order to be that self-directed provider. Um, this is wrong. It says must use PPL first for employment support. PPL first will not be the one doing that going forward next year. But I don't know if they have announced they're called a fiscal manager. I don't know who that fiscal manager will be. But there will be an agency that contracts with the state who essentially, you know, does all of the HR type paperwork. They're the ones who are conducting the background checks. They're the ones who are processing payroll. They're the ones who are processing workman's comp and all of those things. So they take that type of HR paperwork, out of the equation, and they take care of that for you. But you, as the participant or the parent of a child or the legal guardian, you would be the one to recruit, hire, train, and maintain your own staff. And the reason that some people consider doing that is because you are able to pay those individuals quite a bit more money per hour than what somebody would make through an agency. And as a result, it may help you find better staff and find staff who will stay longer and help maintain that staff a little bit easier. Legally responsible individuals, legal guardians, powers of attorney, and healthcare representatives cannot be the paid caregiver under self-directed care. So I do want to point that out. And the reason for that is because if you are an LRI, a guardian, a POA, or a healthcare rep, because you would actually be the one who would or could be signing for that, it would be a conflict of interest. So that is why they are excluded from that. But on the TBI, health and wellness and pathways waivers, you'll be able to use self-directed care for attendant care, respite, and home and community assistance, which is also called homemaker services. On the family support and CIH waivers, you'll be able to use that for PAC services, that participant assistance and care, for residential services, for respite, or for workplace assistance. Then we've got some services that are adjusting. They already exist, but we're gonna make a few changes. And one of those is that Under the TBI Health and Wellness and Pathways for Aging waivers, there have been a few different subcategories for adult day services. Now there's just going to be one category for adult day services. The TBI waiver is now going to allow shared staffing for residential habilitation so that if somebody wants to move out of the family home and have a roommate, it makes that a whole lot easier. They're updating the supported employment definition for the traumatic brain injury waiver, again, to help make it easier for people to work if they want to. And they're going to combine home modifications and home modifications assessment just to take an extra step out of that. I mean, the services are still happening, but instead of they're trying to make it a little bit more administratively simple and merging those services together instead of having them as two separate services. We've got a couple of services that are expiring. They're going away. The first one is intensive behavioral intervention, and quite frankly, that's mostly because it was not a very used service, so they are fading that out. They are also going to prevent any new enrollment in facility-based pre-vocational services. Now, what in the world is facility-based pre-vocational services? That's the official name for a sheltered workshop. And so no new individuals will be able to enter sheltered employment, which is where they pay people less than minimum wage while they are working. They are also going to limit certain services. So music therapy will be limited to no more than 6 hours per month. Recreation therapy will be limited to no more than 6 hours per month. Those are both services available on family support and the CIH waivers. And then they're going to make a lot of changes to what is currently called behavior management services. It's going to be called behavior support services. And this is really kind of redesigning that. First of all, instead of it all being one thing, they're going to break behavior support services into 4 different categories. Consultation. So if you just need, things are normally fine. You just want somebody that you can call up and, ask questions of or bounce ideas off of. You just really need, a consultant every so often. You can get up to 3 hours per month of consultation services for behavior support services. If you need a functional behavior assessment done, they can bill up to 20 hours in a 60-day period for that functional behavior assessment. Comprehensive behavior supports, which is what we typically think of with behavior management, you can get up to 12 hours per month of the comprehensive behavior support. You can appeal for temporary additional hours. There needs to be a reason, like let's say, for example, sorry, I don't have good examples of this, but let's say, mom passes away or there's a house fire or something like that, where suddenly we need a lot of additional supports for that because those are major changes. You can petition for a temporary increase in that comprehensive behavior supports to help them get through that crisis period or that increased needs time to help them get through that. And then you can bill for up to 1 hour per month of clinical supervision. The other really big change with behavior support services is not only are they capping the hours per month based on the category, you can only have one category per month. So for example, you would not be able to get comprehensive behavior supports and do a functional behavior assessment in the same month. It would be an either or. There are also some major changes coming in 2027. The state is referring to it as waiver reset. I'm going to push back a little bit and say, nope, we're talking a total redesign of waivers. So the 4 waivers that exist right now being the family support, CIH, health and wellness, and TBI waivers, they are not going to exist in 2027 the way they do now. And so they are looking at a wholesale from the ground up redesign of waivers. And they are holding focus groups and listening sessions right now to help them craft those changes. They want people's input on this. And in fact, tomorrow, from noon until 1:30, they are having a virtual open listening session for that. And you can register through that link. But you can also send your written comments and ideas to an email address so that you can, put it all together with what you think it should be. And so you can email DDARS waiver reset at fssa.in.gov. And one of the most important things I'm going to recommend is that you stay in touch. Follow InSource on social media for updates as they put out new information. Follow the Arc of Indiana for updates because we are going to get you that information as soon as we can, and you can rely on the information that we give you. Because the reality is, not only is there a lot of misinformation out there and a lot of misunderstanding and misinterpretation, more importantly, there's also a lot of old information out there. And so, when you're talking with InSource, when you're talking with the ARC, you can you can be assured that you are getting the most accurate and up-to-date information that is out there. I'm also going to recommend that you consider signing up for the Arc of Indiana's legislative memo. We typically only send it out once a week, so we're not going to clog your inbox with spam. But we want you to know what's going on, especially with the Indiana General Assembly. In normal times, we only send it out once a week while the Indiana General Assembly is in session. This past year, because there have been so many changes going on at both the state and the federal level, we continued it throughout the year, but after the Indiana General Assembly was done, we weren't sending it out on a weekly basis. We were sending it out periodically. So consider signing up for that memo, and you can do that through that QR code so that you know what's going on at the State House, because there are so many things going on because the information is constantly evolving. And so you want to make sure you are getting your information from reliable sources. And I saw it on Facebook is not a reliable source, just because there are so many things that are changing and so many, like I said, misinterpretations of certain information. So at this point, I want to open it up to questions because I know that with all of the changes we've been talking about, that, you know, that there is a lot of confusion. And so I want to make sure people are able to ask whatever questions they have.
Karly, we don't have any questions
Okay,
on my end, but I have a question,
please.
which you may or may not be able to answer, and that's fine. But I was curious when a couple of slides back, talking about behavior support, behavior assessment,
Uh-huh.
you also listed up to, I believe, 1 hour a month of clinical supervision.
Correct.
Could you give me an idea what that might perhaps look like?
Sure. And typically speaking, in the past, what clinical supervision has referred to, because it's always actually been built into the service beforehand. Um, so what that would normally be is if someone was on psychiatric medications and there was a change in those psychiatric medications, it's somebody who is a clinician, normally an HSPP, and I cannot remember what HSPP
Right.
stands for at the moment. But somebody to kind of review that medication change to make sure that that medication change is appropriate. It's really basically having an extra set of eyes on that, and in part to make sure that medication changes in particular are not going to wind up acting as a chemical restraint. Because I think we've
Right.
all heard horror stories where somebody was essentially in a drugged up stupor. That's an extra set of eyes to make sure that didn't happen.
So, like
Um,
the psychiatrist or someone who
right.
might administer or change
Mhm,
medication, and you
mhm.
could possibly get
Right.
1 hour a month. And
Right.
you stated that you could only utilize one of those
Right.
areas a month. Okay.
Yes. That can also be where sometimes, especially when a new behavior support plan is put in place, or if there's a change in, it's called a person-centered individualized support plan, or PCISP. That is your waiver plan. Think of it like an IEP without the drama. Okay. Um, but that PCISP lists not only what your waiver services are going to be, but what are the things you're going to be working on? What are your hopes? What are your goals? What are your dreams? What are the things you want to work toward? What are your strengths? What are the things you need support with? All of that is in that person-centered individualized support plan, or PCISP. And so one of the other things that they can do with that clinical supervision is also look over that to make sure that nothing is what's called a human rights violation, where we're not inadvertently restricting someone's civil rights and their human rights in all of this. And don't get me wrong, normally things like that are very unintentional. So please don't misunderstand and think, there are a ton of bad actors out there, because it's not. But sometimes we act, sometimes we, and I say this as a parent where I've had to train myself on certain things where it's, I need to remind myself things like, no, I need to ask my son before I open his mail, because he's an adult and I'm supposed to do that. I'm not supposed to just go open his mail. And so, some of it is things like that. That's kind of a milder, situation there. But that's what that clinical supervision is really for.
And I have a second question.
Please.
So, in the state of Indiana, as in most states, I would guess, but I particularly know about the state of Indiana, we are working toward having individuals with disabilities work,
Mhm.
right? We want them to
Yes.
be working. We want to raise the level of the percentage of individuals with disabilities that are working.
And
Could you?
people with disabilities can
They
work.
can work, and
Oh,
you
and they're great
typically, and
employees.
exactly, that is exactly it. Could you speak a little bit to the just general, the individual who is working may be earning a little more than that
Sure.
cutoff, but they
Mhm.
still have their waiver and they have
Yep.
Medicaid as a health plan.
Sure.
Could you speak just a little bit what that might look like? Because we
Sure.
want
Sure.
individuals to have that opportunity.
Lisa is really trying to give me code of, Karly, don't go off on for a really long time, because she knows that I can do that. So, the irony in all of this is that, especially once a person becomes an adult, in order for them to have a type of Medicaid that is compatible with the waiver, the Social Security Administration has to say that they are disabled too. And um, and Social Security, and when I say that, what I mean is they need to either be on SSI or SSDI. Sometimes Medicaid office will insist, oh, it has to be SSI. No, it can be SSI or SSDI. I joke that we're the purple sparkly unicorns of the world because our kids qualify for all sorts of programs and break most of the rules in the process. This is one of those ways. Um, but a lot of times, Social Security will say you can only get SSI if you can't work. You can only get SSDI if you can't work. That's what they say. That's not what they mean, though. When they are saying that, what they mean is you cannot engage in substantial gainful activity, which next year in 2026 means they cannot make more than $1,690 per month in countable income. There needs to be a big neon flashing asterisk next to that word countable, because there are a lot of ways that you can reduce how much of a person's income Social Security is actually counting. And I'm trying desperately not to go into the weeds and totally failing in the process.
You're
Okay.
fine.
Um, but when we're talking about people with disabilities who want to work, there are all sorts of options. And so, first of all, when you have a waiver, there are already work incentives built into the program. I'm going to use 2025 numbers because sometimes um, the numbers we use are based on Social Security numbers. Those numbers have been announced for 2026, and sometimes they're based on the poverty level. Those don't get announced until the end of January, so we don't have the 2026 numbers yet on that. So I'm going to switch to 2025 numbers here for a moment. Normally, for a person to be on Medicaid disability, they cannot make more than the poverty level, which is $1,304 per month. When you have a waiver this year, you could make $2,901 per month. I literally have a post-it note on my
Yeah.
other screen to remind me. Okay. Um, so substantially more money, more than twice as much. So that's one of the ways. our loved ones can work. One of the other ways is there's a special category of Medicaid called MedWorks. It literally stands for Medicaid for employees with disabilities. Essentially, about 25 years ago, the state recognized that there were a lot of people who wanted to work, or a lot of people with disabilities who wanted to work and who could work, but they needed the Medicaid health coverage so that they were physically healthy enough to be able to work. So they created MedWorks to let people with disabilities buy into Medicaid. Here are the three best parts. Number one, as a single adult this year, you could make $4,564 a month from all sources, which is just under $55,000 a year from all sources in countable income and still have full Medicaid. Number two, with this type of Medicaid, you can have retirement savings like a 401k or an IRA, and Medicaid will not count it against you. Number three, it is waiver compatible. Because again, not all types are. Now, if you're thinking to yourself, wait a second, Karly, this sounds way too good to be true. What's the catch? First of all, good on you for asking that. And there are a couple of catches. First catch is at some point, Social Security has to say you are disabled. But if you work off of Social Security benefits, there's a version called MedWorks Improved, and that's what it's for. Number two, you do pay a premium with this type of Medicaid. The maximum premium for a single adult is $187 a month, and that's if they're making 55 grand. So it is actually affordable. Number three, and probably the biggest catch, no one's ever heard of it, including the Medicaid office, who 90% of the time will tell you it doesn't exist. I swear to you, it does. But that is one way our folks can work. And that's just it. They make incredible employees. They show up every day. They're not complaining about work. They do what they need to do. Yes, it may take them longer to do something. Yes, they may need to have some accommodations. But once an employer starts working with people with disabilities, they recognize, oh, this person's great. I love having them here because they also know they're going to show up every day. They're going to do their job and they're not leaving in 3 months. So people with disabilities are great employees. And there is so much pride in being able to work. My son has been working for several years now because, again, he went to the Erskine Green Training Institute and he was trained in their supply chain program. And those are the same skills he's using in his job now. But he also loves the fact that he can go buy an action figure whenever he wants to, because that's what he likes to spend his money on. He also loves the fact that, whenever he wants, he can just walk on down to Jimmy John's and get himself some lunch because he can. There is pride in that, and that's a good thing. If you don't mind me doing a shameless plug,
Nope,
I,
that is
I will
fine.
also share the Arc of Indiana also does a monthly webinar series called Ask the Arc, and we have all of those on the Arc of Indiana's YouTube channel. In November, no, take that back. In October, because it was Disability Employment Awareness Month.
So,
In October, we had a session on work incentives, which applies to typically to Social Security, but we talk about um, different ways that people on Social Security benefits are able to work and able to document a variety of work incentives to either help maintain their Social Security eligibility or to actually help maintain specifically their SSI check, and as much of those benefits as possible, but to help them maintain those benefits or to help make a concerted, a concerted plan to work off of benefits if that's what you'd like to do. So we have that available as well, and
great.
you're welcome to watch that.
Thank you, because I just thought it was important as we all look at having our best
Yeah.
life.
Yeah.
Individuals have
Uh,
every right to the education, to work in the community, to have
mhm.
relationships. And
Right.
I just thought it was important to, again, focus on once you stop going to school
Yes.
and you start looking at what does a good life look like,
Right.
employment,
Uh-huh.
volunteering activities, what might you be able to do? Thank you,
Well,
Karly, for
well,
that.
And in all honesty, there is a lot of enjoyment. There is a lot of value and in the quality of life, in knowing that you can,
Contribute.
that you can contribute. See, she's being all nice because I'm thinking the more materialistic things. Know that you can go shopping when
Yes,
you want to and
that's
buy the things.
correct.
That's why we all work. We may love
Yes.
our jobs dearly, but it's also so that we can go buy that 44-ounce soda
Yeah.
with the good ice, you
Yeah.
know?
With the good eyes, and hit that Amazon button that you want to order
Yes.
something. Absolutely. Jill, I'll turn it to you because you might have some questions
We
on
do.
your end.
We do. We have some
Okay,
Facebook Live questions. The
perfect.
first one is, can you go over parents being paid as caregivers for minors with the FSW again? I
Sure.
didn't understand it all.
Okay, that's okay. And if you don't mind, I'm going to be looking because that's on my other screen here. And I want to get this part right. So the idea of parents of minor children um, on the family support waiver getting paid will be brand new. This has never happened. Oh, well, it happened briefly during COVID, but this is not something that has been a consistent thing. So this will be brand new. In order for a parent of a child under 18 to get paid, first of all, the state has to believe that it is in the best interest of the child. Okay, for that parent to be the paid caregiver. But the child must also meet the state's definition of needing extraordinary care. So when they say that, they are looking at caregiving needs beyond the typical um, age appropriate caregiving. Okay. So especially this will really impact those really little kids. Okay. Well, most really little kids, have high needs, whether they have disabilities or not. You know, a 2-year-old is rarely potty trained on their own by the age of 2. If you were able to do that, man, good on you. I'm jealous. Neither of my kids, my son with a disability, my son without, neither of them were potty trained by the age of 2. Um, you know, the fact that a 5-year-old cannot bathe themselves. Well, most 5-year-olds cannot bathe themselves. That is not an age or a developmentally appropriate skill for a 5-year-old. So they're looking at that piece of that. What is extraordinary caregiving? Well, if you've got a tween or a teenager who cannot dress themselves or cannot shower or bathe on their own or cannot go to the bathroom on their own, that would be considered in that extraordinary care definition, because helping a 10-year-old bathe, helping a 10-year-old get dressed, helping a 10-year-old with going to the bathroom is not something that a typical 10-year-old needs. Okay. But then they're also looking to see if that child has intensive nursing care needs. Again, the state very specifically did not include behavioral needs in their definition at this time. They were looking more at the physical health care needs. So they're looking to see, is this child continuously on a ventilator? And they meant continuously because we suggested, hey, there are some individuals who only need that ventilator at night. Just because they don't need the ventilator during the day shouldn't preclude them from this option. The state said, nope, we're looking for continuous, somebody who's continuously, constantly on a ventilator because they cannot breathe on their own. Tracheostomy care. I don't know what that is. I'll be honest, I'm not sure. Um, I know what
Karly,
a
that
tracheotomy is. Is it the same
exactly.
thing?
Yes,
Okay,
the same thing in the care
okay,
that you might need to
okay,
keep that.
okay. It's because they put 2 extra letters in it. I wasn't sure. Both of
Or
my
I
sisters
think
are
so,
nurses.
as far as I know.
I joke. Both of my sisters are nurses. They would understand this stuff. I'm the one who can find you a loophole. So, um, total, and the reason I said TPN is because I can't say this next word very well. Total, peritoneal nutrition. I think I said that right. I can't swear to it. But think of it more like a G tube or a J tube, or something along those lines is how I interpret that. Lisa, if you got different information,
It is more intravenoususly into the,
Okay.
yeah, it's more medically involved is what I will say.
Okay.
Since I
Okay.
don't have a lot of experience, but I've
Okay.
just had some friends who've
Okay.
had that experience with their child. So it is more,
Okay.
needs more medical oversight,
And,
and involves some additional risks.
okay. And that's really kind of the overarching theme. When they're looking at extraordinary care, they're looking for those really high medical needs. And you would have to meet those really high medical needs in order to be the paid caregiver as the parent of a minor child. Now, once your child turns 18, all those rules change. But it's while they're under the age of 18 that matters. Jill, what else we got?
Okay, so we've got 3 questions kind of rolled into one. So let me read it and then we can break it down if you would like.
Okay.
Parent and sibling can no longer be paid caregiver on FSW waiver for over 18, question mark.
No, that's completely wrong. They can still absolutely be paid caregivers.
Okay. And if going the new self-directed way, siblings cannot be caregiver, question mark.
Um, unless that sibling happens to be the legal guardian, the power of attorney, or the healthcare representative, if they are not any of those three, they're just brother, sister, yep, they can absolutely, the sibling can absolutely be the paid caregiver under self-directed care. Unless, like I said, unless they are the legal guardian, the power of attorney, or the healthcare representative.
Okay, the next question is have to use company off pick list for them to be paid caregiver for over 18, question mark.
Okay. That's where I'm going to break that answer down a little bit. Um, under normal circumstances, I'm going to say yes. You would need to go through an agency on the pick list, unless you are using that self-directed care, and that's where that changes. If you are using self-directed care, you are not going through any of the agencies on that pick list. You are working with whoever the state's new fiscal management services provider. Lisa, have they announced who that is yet?
I am not positive. I would
Okay.
hate to misspeak.
Okay. Okay. Sorry, I totally put her on the spot there. That was not fair of me. But if you are using self-directed care, and again, this is going to be a brand new thing for the family support and CIH waivers. Health and wellness has and TBI have been using this for a few years, but this will be a new thing on the developmental disability waivers. If instead of using an agency, you talk with your case manager, they connect you with whoever the fiscal services manager or manager services will be. You, as the person who is directing the care, will actually do some training with that fiscal management services provider to help you learn basically how do you be a boss? How do you find appropriate staff? How do you retain them? How do you do that training? So it's really support to help you be that boss of the people that you hire for self-directed care. And here's where I'm going to give an example. I'm going to totally make up numbers here. These numbers are not correct. They are round numbers to make life easier. Okay. Let's say you are using PAC services. You go through an agency. The agency is paid $35 an hour for PAC services. Now, what people often don't recognize is how much overhead those agencies have. Not only do they have to pay the rent for their building and their electric bill for their building, they've also got to pay for the benefits for all of their employees. They're constantly doing recruiting and hiring. So there are a ton of HR costs. Then they've also got their liability insurance and all sorts of other costs. So $35 goes to that agency. They're paying $15 of that to the direct support professional, okay, to the DSP who's actually providing those services, okay. That's how it typically works. With self-directed care, and again, these numbers are all made up, okay. Instead of the $35 going to the agency, 10% or $3.50 will go to that fiscal management services company for them to be able to process payroll and do all of that type of stuff. The remaining $31.50 would be paid directly to the DSP. Now, then again, they're also taking out taxes and all that fun stuff like you do with every other employee. But that's how that would work. Okay, so that is why some people are considering using self-directed care, is because they would be able to hire people directly, people that they trust, people that they can vet, people that they can train directly, especially when they've got loved ones who may be more complicated. Not just physically complicated, but you know, making sure that they understand, all of your loved ones' quirks and their interests and what works for them, all of those things. But you would be able to pay them more money because the money is going directly to them.
Karly, you are a wealth of knowledge. And I think one of the things that we want to take away is to be informed,
Mhm.
to come to the ARC site, InSource's site. We have Indiana Family to Family. We have a lot of good vetted resources to understand self advocacy as the
Mhm.
individual, self advocacy for your loved one,
Mhm.
right? Learning about the system and the process and how to share your voice and how for them to share their voice about their own
Making sure that
life.
we're teaching our loved
That's
ones
correct,
how to do this and that they have the right
right? To
to
do
speak
that.
up.
That is
But they
correct,
should be doing that. That's one thing that can often get overlooked. And, think about when our kids were little,
right?
whether they have disabilities or not. When they were really little, we just tied their shoes for
Yes,
them because we did not want to wait a half an hour while they tried to tie their own shoe, and it
yes.
was quicker and it was easier and it was faster.
And we made the decision
But
for them.
but when we did that, what that meant was we weren't teaching them how to tie their own shoe. So then they didn't know how to do that. So even though we were just trying to be faster and easier and it just made life simpler, we didn't realize that we were taking something away from them. Same is true for our loved ones with disabilities. We need to make sure that they understand, you know, that these
Yes,
services are available to them, that they get to choose what services they want to use, that they get to choose who they want to work with.
that's right.
And if they have somebody that they're working with who they just don't like, maybe it's
Correct.
that they just don't gel. Maybe it's that they have nothing in common. Or maybe the person's just rude and condescending to them. They have the right to choose someone else. They hire them, they can fire them. And we need
That
to
is
teach
true.
that to our kids. We need to teach them that they are the ones who get to direct their own lives. We teach
So
them
we
that.
have a couple more
Okay,
questions.
Oh,
sorry.
It's okay. Over 18 qualify for waiver is based on SSI eligibility, correct?
I'm going to say with an asterisk. So it's that the Social Security Administration has to say they are disabled. The easiest way for that to happen is for them to be qualified for SSI, but it does not exclusively have to be SSI, and sometimes the Medicaid office does not explain that appropriately. So, like if you've got a child who's on SSDI, and the way that would often happen, especially if we're talking about somebody who's 18, is because they had a parent who is retired according to Social Security. If they have a parent who is disabled, or if they have a parent who has passed away, they would be getting SSDI benefits off of that parent's work history. That counts too. And so sometimes that is not explained well. So I will have people who are on SSDI and they'll call me up and they're like, the Medicaid office says I can't be on SSDI. I have to be on SSI. That is not correct.
She says, but I've heard many are initially denied. My son is
Yep.
17.
Uh-huh.
When do I need to start applying? What if he is initially denied?
Um, I'm not allowed to say that that would be standard operating procedure because that gets me in trouble if I say that. So I won't say that. Okay. Um, what I will say it is incredibly common for people to be denied twice um, with a Social Security application. I have don't kill me for saying this, Lisa. I've got an entire webinar on navigating the SSI process. You'll find that on the Arc of Indiana's YouTube channel. And I get, don't kill me because it is very, very content heavy. Okay. But what I do is I explain how Social Security makes their decision and then what type of information you need to provide to help them get through that process and what that all looks like. So I will recommend watching that and then calling us with any questions you have, because again, it is very, very content heavy, but you can also stop and rewind and break it up into sections, all of that, because it is a lot. It is a bigger process than I think any parent is ever prepared for. It is far more involved than parents are really ready for. And to be fully transparent, one of the reasons I learned so much about Social Security was because I knew my son was going to have trouble getting through the process. So I was learning everything I possibly could very selfishly to make sure my own kid qualified. So.
Okay, it says, will he lose Medicaid and waiver services while we have to appeal?
Okay. I am so grateful you are asking this. While you are appealing, um, he can keep his Medicaid and keep his waiver. This is true of Medicaid in general, because one of the things we are getting a ton of calls about right now is we are having a ton of people who are having trouble with their Medicaid. They are getting notices that their Medicaid is going to be terminated. Oftentimes it's because Medicaid has sent a request for information that never actually got to them. So they didn't know to send in the information. And so that has caused all sorts of problems. If you appeal before that Medicaid is actually terminated, you can keep your Medicaid and therefore keep your waiver in place while you are going through the appeals process. And the Social Security appeals process to get through the entire, both sets of appeals is easily about 2 years. Yes, your loved one can keep their Medicaid and keep their waiver during that entire process.
Okay. And it says, is how long do we have, and do we have to reapply for the waiver? So you've
Yeah.
obviously answered that
Yeah.
because
You
they can
you do
keep it.
not have to reapply for the waiver. Okay. As long as you're able to maintain the waiver, you would not have to reapply for it. Um, Typically speaking, when we're talking about a Social Security denial, you've got 60 days to appeal that. When we're talking about a Medicaid denial or a potential Medicaid termination or category switch, with a Medicaid termination or denial, you've normally got 33 days to appeal that. If it's a category switch issue, technically speaking, you've only got 13 days to appeal that category change. Okay, so it's a much tighter timeline, but often Medicaid has traditionally been willing to work on that. Like I said, I'm seeing a ton of problems people are having with Medicaid right now.
That was all that I had. Thank you so much, Karly. I do have a very, very I don't know how to really say it. I want to say selfish question, but it's really not. I just want to know, because this came up in a conversation I had with a coworker today. We were talking, and we were talking about how many parents that we still are having to say, "Have you heard of the waiver?"
Right.
And I'm just amazed
Mhm.
and at how many are we're still having that conversation, because
Yeah.
I look, 24
Right.
years ago when I applied for my son,
Hmm.
it was
Hmm.
very unheard of.
Hmm.
I feel like we're still in that process of making sure everybody hears about it. And, so it's like, is it that is it that you really don't want people to, I don't know how to say this really without, kind of like that, if you don't borrow trouble. So let's just keep it out there, but those that find out. So I guess what my question is, how do we make sure that people are hearing about the waiver? We know we can't, there's no more money for it. And we know that, things are in a spot
Yeah.
now. And I would hate to just completely influx the system, but yet
Yeah.
it's still concerning that we pick up the phone at
Right.
InSource and we have parents that, what are you
Right.
talking about?
Right. You know, Part of it is the three of us are all our kids are all of that generation where they had to wait a decade
Yeah,
to get the waiver.
yeah,
Um, because not that long ago, the waiting list was 10 to 15 years.
yes.
Um, I am, there is part of me that is worried that we are sliding back because we are sliding back. We're not there yet, and I hope we never get there again. But I will also say, the waiver was a game changer. for my son, and it is for a lot of people. Um, like I said, I think part of it is, when your child is diagnosed, you are given, a huge to-do list. And sometimes they tell you to apply for a Medicaid waiver. Half the time they're also telling you to apply for Medicaid. And these are, doctors' offices and people who should know, but at the same time, these are different programs, so they don't actually know, and they don't know the right wording to use, and the reality is the words really matter in our world, and so I also come across a lot of families who they apply for the wrong program. It's called a Medicaid waiver. You think you would go to the Medicaid office for that, but no, you don't. Don't apply logic to government programs. Logic and government don't like to work and play well together. And so that's part of the problem is we have people who think they're doing the right thing and they apply, but they're applying for the wrong program, then they get denied and they don't realize that's what's happened. Or they hear it's a Medicaid waiver and they think, oh, we make too much money for that because they don't know that we have specialized rules for that. How do we fix that? That's hard because, one of the reasons First Steps has been so successful is because the state has really gotten in with the pediatricians' offices and really stressed how important it is to make those referrals to First Steps. It took a long time for them to be able to do that, but First Steps has really, really great referral rates. Ideally, if you've got a kid in First Steps, they're going to help them sign up for the waiver right then and there. Ideally, because so many students with disabilities are involved with the school corporation, ideally the school would say, hey, you need to do this. Or they would take, now that the family support waiver application is online, they'd take 5 minutes in the case conference and just fill it out. But I think part of the issue too is that, especially like when it comes to the schools and things like that, there are so many things they have to do. This is not one of the things they have to do, and it's just one more thing on their plate. So so it gets, it gets sacrificed because there are so many other things they have to do. Um, I wish I had a magic wand and could give a good answer to that, especially now that the state has essentially banned advertising for Medicaid and Medicaid services. This is going to get much harder. I know that's something that we are doing is still spreading the word. I know that's something you guys are doing is still spreading the word. But like a lot of provider agencies are no longer allowed to do things like that. And so it's yeah, it's I think it's a problem that's potentially going to get worse. And so
Yeah.
I think it's up to us, and making sure that, the reality is, you know, I have learned more from other parents over the years than I have
Oh,
learned in most
absolutely.
ways. Especially before I started working here, and so I think that that's one of the things we need to do is we need to be there for each other because we can learn a lot from each other in all of this too.
I agree. I agree. Um, Delana, I think I got all the Angie's questions, but I really just want to go back through them real quick because just to make sure, um, parent and siblings can no longer be paid caregivers on FSSW waiver for over 18. We answered that one. And if going the new self-directed way, siblings cannot be caregivers. We went over that one. Have to use company off pick list. We went over that. Over 18 qualify for waivers based on SSI eligibility. We went over that. Heard about initially denied. We talked about that. Um, when to apply. We talked about that. What if he is initially denied? We talked about that. Will he lose Medicaid waiver services? We did talk about not losing those. How long do we have? We discussed that. And do we have to reply? I think we got all those, but thank you so much for pointing that out. I appreciate that.
One more thing I want to say, because especially as the waiting list is getting longer, we've had some families ask, "Oh, then should I even bother with this?" I would say yes, because this is something that if this is something that your loved one needs, then yes, because eventually it will be there for them. It may take a while, but it can make a huge difference in their lives. And at the same time, I recognize that we need to be good stewards of those waiver dollars and use what we need. But there's also, and there are a lot of things that parents can do. There also comes a time when they don't want to be with mom and dad. You know, my son does not always want to be with his mommy, and he shouldn't have to be. No other 25-year-old is constantly with their mother. He should be able to go out and do things on his own. And that's part of this too, is to help foster that independence and that, you know, that quality of life. And so, yes, even if it's going to take several years before your loved one can get this waiver, go ahead and apply now so that it is available to them later. Because the longer you put off applying, the longer it's going to be before they actually get the support and help that they need.
Well, Karly, thank you again so much. And I just want to remind everybody that you can go on to, is it the website for the ARC, Karly? What is that?
ARCIND, short for Arc of Indiana.org.
And you will be able to find a plethora of information there. I go on there a lot. So please go on there and you will be amazed at what all you do find. Karly will be back on the 22nd of January, Lisa.
Yes, the 22nd of January, Karly will be back talking about the differences of supported decision making versus guardianship. And just like what we've been talking today about an individual's own rights. And when we have a loved one that might need some extra help, what do we consider?
Well, thank you again. I don't want to, it is 3:01. I want to be respectful of your time, Karly. And Lisa, thank you so much for being here with me today. I always learn so much. Ladies, I look forward to seeing you on the 22nd. Lisa, I'll see you on the 18th of December.
That's right.
Karly, you have a wonderful day and a wonderful holiday.
Yes.
And see you in 2026.
Well,
Right.
thank you everybody for joining us today, and thank you so much for having me. So,
absolutely, you're wonderful. Thank you all, and remember again, InSource is your parent training center here in Indiana. ARC is Family Advocacy Organization. Please visit our websites and have an excellent day.